Hello and welcome to This Week in Medical Records and the Law. This week we're going to discuss things that again have dual purpose to each of you. And that means this is information that you will need for your future career. But because, okay, back up for a second. You will need this information for your future career because as you progress into management, you will need to make certain that HR laws and other elements of this discussion of workplace legalities are being complied with. Okay. In addition to that, you will be a staff member. And you know, sometimes, most of the time, individuals must watch out for themselves. So you need to know the law to protect yourself in case your facility is not complying with the law. So you have this dual benefit of today's discussion and everything else that you learn in this class, right? Right. Okay. The first thing that I wanted to discuss with you is the doctrine of corporate negligence. And this federal law states that hospitals can be held liable for the competence or incompetence of their staff. So that means that not only the individual who broke the law, such as filing a false claim, okay? Not only that individual can be held accountable by the law, but the facility itself can be held accountable if they did not make certain that you were qualified and being compliant with the law, okay? Now, most facilities will ask you as an employee, especially one in medical records where national certification is highly regarded, will have you update your employee file with regard to what certifications you hold and your qualifications, CEUs, things like that, so that they have a file folder, if you will, on how they're making certain that you continue to stay educated so they can continue to be confident in your ability to comply with the law. Okay. Now, we've talked about this before. We've talked about fraud and abuse and how intimidating it can be when a supervisor or a physician says to you, code it this way, I want to get paid for this, or whatever the situation may be, where you get that ugly feeling in your stomach, where you remember that we discussed that and you know that it's wrong, but you're afraid to speak up because you may lose your job. Well, the doctrine of corporate negligence and the facilities mandate to make certain that you keep your credentials current may put you in the jackpot federally as well as under state law all by yourself. The fact is that it is your responsibility to make sure that you keep those credentials up. And when you are the manager, you must make certain, and don't take anybody's word for it. Okay. Somebody could tell you on their resume they have their CPC or their CIC. And you say, okay, good, that's what we're looking for. No, you got to go to the AAPC website and you have to confirm that AAPC or a HIMA or whatever credential they're claiming is valid. That is known as due diligence. And I'm sorry to say, although I think it was Ronald Reagan who said it many, many, many years ago, trust but verify. That is your obligation as a healthcare professional. Trust but verify. And whether you are responsible well, the HR department, for example, would be responsible for doing the same thing for the physicians and the nurses, making certain that their state licenses are kept up to date. They have CEUs, continuing education units, also required. The fact is that somebody in administration must be responsible to confirm that these individuals are legitimately credentialed to work in healthcare, in your healthcare facility. Okay, so it's not only important for you to do this, but for you to make sure others are when you are the manager. Okay, and now you can understand when they keep asking you once a year. I have to fill out that form once a year. Okay. All right. Equal Employment Opportunity Act. This is a federal law regulating hiring and firing of individuals based on race, gender, or age. Why anybody would not want to hire the most qualified candidate for the job is absolutely beyond me. And to not hire someone because of their gender, because of their race, or because of their age, unless they're too young, okay, is, again, it's shooting the company in the foot. It makes no sense. But just know that beyond it making no sense, okay, what you must make certain is resumes do not include any of this information, because it's hard for you to defend if you don't hire somebody and they think they should have been hired and they have their age or their gender or their race or something else covered by this law on their resume. It becomes harder to defend. I did not hire this person because of that information. So you must make certain that all resumes accepted and reviewed comply with this law. You know, it's sometimes the pendulum swings too far, but the fact is that there are people doing this right now in 2022. It makes no sense. It does not make good business sense under any regard. It does not make good business sense. You want the most qualified person to be sitting in that chair or doing that surgery or whatever it might be. Okay. If you discover that your facility outside of your department is doing this, you might want to tell somebody. All right. OSHA, very, 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 very important, because OSHA, which stands for the Occupational Safety and Health Act, is the federal law that makes certain you have a safe environment in which to work. And you as a manager have to make sure that your staff members have a safe place to work. This has to do with needle sticks. This has to do with puddles on the floor. This has to do with cables from computers that fall across a walkway, whatever it is. And in healthcare, we have like the largest section of OSHA. I strongly suggest that you go to the website. It's OSHA.gov because it's federal. healthcare. And you may be amazed at all the things this law covers that they demand of your facility to make certain you have a safe workplace. And this has to do with not only your physical safety, but it has to do with your health safety. And what I mean by that is, for example, asbestos in the ceiling. Okay, you're breathing that in, you're getting a respiratory illness. That's covered, as well as making sure you have PPE. Now, since COVID, everybody knows what that means now. Personal protective equipment, masks, head covers, gowns, whatever might be necessary. And if you think because you're working in medical records and administration, that you would have no reason to go into a patient's room, a patient who might have an infectious disease, you're wrong. There are reasons. There's paperwork that needs to be done. There are things to work out with regard to coverage and discharge placements and all kinds of stuff like that. So the fact is we never assume in healthcare. And this is important knowledge, again, for you to know, not only as a staff member, but as a member of management as you grow into that position. Okay. Also included, and these are not actually laws. This comes back under good business. Okay. Now, it is the organization's job to make certain that all staff members are working to their optimum capacity. We all know, each one of us have those days where you're charging, right? You're productive, you're doing stuff, you're getting stuff done, you're dotting those I's and crossing those T's, and it is so great. And then you have those other days where you're kind of like Eeyore from Winnie the Pooh. You know, it's like, I'm here, oh, dotting an I, I'll cross that T later. Okay. I'm not saying you're hungover, but I use it as an exaggeration because we all have fluctuating capacities, right? And maybe you're doing a task that you really hate. So you're going to be a little less enthusiastic, a less motivated, a little less, I just want to get this over with. Where when you're working on a task that you really love to do, you're cooking with oil. Okay, so olive oil, of course, because it's healthier. So the point is that management's attention to motivating and encouraging their staff, again, is good business. So I wanted you to be aware of a couple of different things, and this is also very handy information for you when you start to go out on interviews after you graduate. Okay, intellectual capital, you know, computers, software programs, this EHR program versus that, this patient management system versus that. You know, ultimately, anybody can buy hardware and software and equipment. Anybody can buy that, which makes every healthcare organization equal on an equal keel. Okay. What makes the difference is intellectual capital, the people, the assets provided to an organization by the people that they hire, the ideas, the innovations, I learned about this in school, and maybe we can look to incorporate it because it can improve or whatever. Okay. Whatever your particular path is, okay, energies, efforts, reading an article, attending a local chapter meeting of AAPC. You learn about something, you bring it back to the office and you say, oh, wow, this is interesting. We need to look at this. That comes from the people. That's what you have to offer. And now, as you are looking forward to the time when you will graduate and hit the bricks, as they say, looking for a job, I want you to keep track of what you have to bring. And that's what's in here, what's in your head, okay? Not your GPA, no, not even your certificate, definitely your certification, because that's proof positive of what you learned, okay? But the fact is that you have more to learn, you have more to offer. Think about those things, seriously write them down. So when you are in an interview, you can provide examples of the intellectual capital. What are you bringing to the table? That's what an interviewer wants to hear. Okay? Seriously, serious. I'm there. Okay? All right. Employee retention is something else that is very key to successful business. And it's also something that you want to look at with regard to where you want to work. Okay. And once you get into that management position, you want to make certain that you are listening to your people. You are doing everything you can to enable them to do their jobs. Okay. This does not come with excuses. This comes with, like I said, innovation and ideas. Okay. You know, this is just an example, but another benefit that we get from COVID, okay? Because before COVID, people working from home was, forget about it, okay? But now we have introduced into the world of business that ability, excuse me. So now, if you have a staff member who has a young child who is sick and the staff member needs to stay home with the child because the child is sick, can't go to school or daycare, whatever, you don't have to lose a day. You just tell that person, fine, work from home. Okay. So you see what I'm saying is, being able to work with people so that you can keep the good ones on staff. You want them to stay with the company. Employee turnover, which is people constantly quitting or being fired, and then you hire new people, and then they quit or are fired, and then you hire new people. That's called employee turnover. That is incredibly costly to any company. But a trick is to figure out who the good staff members are so you can keep them and to gain that strength so you can let the others go. Okay, this is so incredibly important to the success of your department as well as the success of the facility. And remember, success in the facility is proof positive, especially in our department. We do medical records, we submit claims. Okay, things are measurable, they are tangible. We can measure how many claims were submitted in X amount of time, how many were denied, how many were rejected. Denied, rejected, that's your department not doing very well. Okay, so we have tangible ways of measuring the good staff members, those staff members who maybe need a little motivation. We're going to talk about motivation in a second, and and those who have more excuses than productivity. This is not acceptable. You can't run a business like that with excuses. And trust me, I hear excuses. Okay, so let's talk about motivation. As a manager, you want to be alert to motivating your people because everybody needs that little kick in the butt sometimes, okay? And there are two types of motivation: intrinsic motivation and extrinsic motivation. Intrinsic motivation, those are your A personalities, okay? They want to do it, they want to get it done, they want to know that they're doing a good job. They are fulfilled by doing themselves, okay? Extrinsic, outside, their inspiration comes from acknowledgement. These are the individuals who need a pat on the head, maybe certificate for perfect attendance, or you know, an award, like you might have some kind of competition of whoever has the fewest denied claims, the lowest percentage of denied claims gets a gift card to Starbucks, whatever. Okay. The fact is that you have to get, first of all, you need to know yourself. What really is going to get you to go that extra step, that extra mile for your job? And then second of all, when you get into that management position, you need to learn about your people and what drives them, and understand that most of this has nothing to do with money, okay? Having to pay someone to stay, in other words, a raise, or I'm leaving, this is not a dedicated staff member. Of course, that raise is extrinsic motivation, okay? It could be a promotion without a raise. It could be an extra half an hour for lunch. I don't know, you have to put on your creative cap sometimes when budgets are tight. But money should never stand in the way of you or your staff members doing a good job. When you go on that interview and they offer you the job, you need to discuss money then. And if you accept that amount of money to go do your job, then you don't have any right to complain that you're not getting paid enough. Right? Okay. And what I always recommend, honestly, is during the interview, if you feel, especially when you're just new into the industry, I like to recommend a staged salary bump. Okay, you have to remember that you are an unknown entity. Whether you have, you know, you might have some experience, you're newly out of school, they're not going to care about your GPA. They will care about your certification, your AAPC certification. But what I'm saying is, they may be a little leery because they don't know really what you can do yet. So what I recommend is, all right, this amount that you're offering me is a little lower than I thought, but I know I can do this job, so I'll accept this with the agreement that in 6 months I get a performance review, and when I prove to you what a good coder I am, when I prove to you how good I am at data analysis or whatever, then you give me a 10% raise or whatever. Okay. I'm not talking specific numbers, but I'm talking about remembering that they don't know you. And your certification gives you proof positive of what you can do, but it's not everything. Okay. So say, okay, I want to work for this hospital or this clinic or whatever. But that's a little less than I had hoped. So let's say 6-month review. All right. Give me the chance to prove to you that I will be an intellectual asset to this organization. And then you can reward me. Okay. All right. This week, you have to read chapter 10, Workplace Legalities. And again, the chapter is going to cover other things. So that's why we have these live chats, so I can give you more. So much knowledge. Oh my goodness. And then you're going to do your homework, and then you're going to do your quiz. And then if you have any questions, you're going to email me, right? You're going to email me with any questions. We can email back and forth. We can set up an appointment to talk on the phone. We can set up an appointment to do a one-on-one Zoom, FaceTime, whatever. I'm here to support you. Even though you cannot see me, you are not alone. You are not alone. I'm here for you. Okay. Happy June week.